Yes. Yes. Our good morning is usually accompanied by the weather. It's quite dull in Bugolovi, but we've had some rain in the past few days, and we are truly grateful for that. You're most welcome once again to the 9th Purposeful Aging team session online this morning, the 27th of September. Our topic is going to touch on a very important topic, that is sleep and aging, practical tips for better sleep as you age. As a small introduction, before I introduce the speaker, I'm sure many of you have had some reasonable amount of rainfall, as I've said, and usually old people enjoy a bit of sleep during the rain. Maybe the guest speaker will explain why that happens. But I see all of you are here now, and we can set the ball rolling. Purposeful Aging team has prepared a very touching topic for this morning, something we all value, but sometimes find hard to get enough of, and that is a good night's sleep. As we age, many of us notice changes in our sleep. Maybe it takes you long to fall asleep. Maybe you wake up more than really necessary in one night or during the night, or just don't fall asleep, and you wake up in the morning when you feel you've not really had a good rest in the night. Many of us who have caregivers, the caregivers do see that their loved ones have had a restless night, and they can't voice it, but they do notice that someone did not sleep well. And for those in practice, the doctors and nurses and everybody else in medical practice, they may also notice effects that have come as cumulative lack of good sleep. It's very encouraging that better sleep is possible with just a few simple changes in our daily habits, our sleeping environment, and the way we prepare for bedtime. We can improve both the quality and the amount of rest we get. Now, in this session, aging tips for getting a good night's sleep is what we are going to concentrate on. We are going to get practical strategies we can use, we can try out at home, or we can pass on to other relatives, friends, old people, so that they share and eventually get a good night's sleep. These skills and tips are going to be given to us for one reason. Deep sleep is not just rest. It is the time the body needs for healing and restoring energy, and for keeping our minds sharp and our moods steady. So we really do need these tips so that we stay healthy. I suggest we take time together, explore how we can make restful nights and more regular and enjoyable sleep as we age. And all these tips are going to be given to us by none other than Dr. Ivan Kimuli. Dr. Ivan Kimuli is with us already, and I would ask him just to greet you before I give that introduction, his personal introduction.
Thank you very much, the moderator, Dr. Christina Kadama, who happens to be a colleague in the profession, but also my mother. I want to greet each and everyone on this call this morning. Good morning. And I hope you had a good night's sleep. Thank you.
Thank you, Doctor. We'll find out if we really had a good night. So, who is Dr. Ivan Kimuli? As we usually do in this session, we avoid those huge words, but I think initially I'll mention some of them. I'm sure he'll later on make them very soft for us to understand. Dr. Ivan Kimuli is an internal medicine physician, sleep and pulmonary medicine, as well as a clinical researcher. Don't be scared, please, of words like pulmonary. That is just to do with the lungs. But we had to use it just to keep his credentials in shape. Dr. Ivan Kimuli is a Ugandan. He did what we call internal medicine. That is, he's not a surgeon. He doesn't hold a knife to do his work or whatever gadgets. He's a physician with 20 years of clinical, academic, and research experience across Uganda, and specializes in pulmonary and sleep medicine. As I've said, pulmonary is to do with the lungs, and sleep medicine is part of his specialty. He holds advanced training in sleep medicine and internal medicine and public health. Those are just 3 aspects of medicine, specialties in medicine. At this present time, Dr. Kimuli is serving as Deputy Managing Director and Director of Clinical Services at the Makerere University Lung Institute, in brief MLI. Dr. Kimuli provides strategic leadership in clinical services, medical education, and research innovation. He has previously led the clinical services department at MLI, as I've said earlier, expanding specialized respiratory services and sleep medicine. And he has been instrumental in shaping Uganda's response to public health emergencies such as Ebola and COVID-19. And this was through his role as a case management consultant with the World Health Organization. He is a registered practitioner in Uganda Medical and Dental Practitioners Council. That's the body that registers doctors. He's nowhere near a Chichupuli. And also is a member of the American Academy of Sleep Medicine, reflecting his commitment to bridging global expertise with local health priorities. Purposeful Aging is greatly honored for this morning to have you, Dr. Kimuli, taking us through this topic. We are very, very greatly honored. I hope you have appreciated that this is a seasoned doctor and he has taken time in studying this sleep, as we call it. Dr. Kimuli, before you, we have about 40 participants online, and most of us are people above 60 years. As you mentioned, we are your mothers, some are your mothers, fathers, and they are people who we stay with, who take care of us, caregivers. They are not necessarily medically oriented, but they do take care of us. And also we have people below 60 and take care of the above 60 in different ways, or one way or another, especially financial assistance or advice, transport to and from hospitals. So it's a great mixture of us, and we don't all have background in medicine. So we tend to keep this non-medical, but practical for what happens to us as we age, and not necessarily when we are in hospitals. You have like 45 minutes, and after that, we shall interact by way of question and answer. And really, the floor is yours. You're most welcome. Thank you so much for accepting to share with us this morning. You can unmute and go ahead. Thank you.
All right. Thank you very much for that wonderful introduction. And please feel free to stop me in case there are things that may look a little bit very abstract. Let me try to project my slides here. But like I said, a warm welcome to each and everyone here today, and hoping that everyone had a good night's sleep, because sleep is something that is very important, and it is part of life. We cannot do away with it, and I'm happy that my colleague, Dr. Philippa, reached out for us to have a discussion on sleep. I look forward to engaging even beyond this after this discussion. So for today, I was requested to talk about some, I'll take this out of my field. I hope everybody can see my slides well now. Okay.
Yes, we can see them.
So today we are going to talk about sleep and aging. And I hope we can really keep it simple. It may be difficult to go around the scientific bits in all the slides, but I'll try to make it as simple as possible. So the objectives of the talk are as follows. As we grow, we notice that things change. Many things change. Actually, someone said things break. So today we are going to explore together how sleep changes as we age, and what gets in the way in relation to sleep. We shall also discuss some misconceptions or myths that we hear in our communities, but more importantly, what we can do at home to feel better or to have a better sleep. So just for you to ponder, I don't know what you really think about these three questions. Do older people need less sleep? I think it is something that people out there in the communities, um, I've seen executive people say that they don't need to sleep a lot. But is this exactly true? Probably not. Snoring, is it always normal? I don't know how many of us here snore. Is it always normal? Probably this is also not true. And then daytime naps, are they harmful? Are they nice? Are they something we should do away with? Because these are common things amongst the elderly people or the seniors of the community. These are not always harmful. I think those are the simple answers I would give to these three questions. So before we dive in, let's remind ourselves why sleep really matters. Sleep is definitely not a luxury. It is a necessity. As you may all know, we spend a third of our lives sleeping. And when we sleep well, we have many good things. We have a good memory, we have a good mood, our energies are high, just like the facilitator mentioned in her opening comments and remarks. So if we do not get a good sleep, we are at risk of very many health problems like high blood pressure, diabetes, and heart disease. And good sleep also means clearly a better quality of life. You are more patient with yourself. As seniors, you're more patient with grandchildren when you sleep well. You're not grumpy. You have more strength for work and even more joy in everyday living. So sleep is not a wasted time. It's actually a healing time for all of us, both young and old. Sleep is not just for children, even though many people think children sleep a lot, but sleep is a necessity for every age group. The exact number of hours that are recommended for sleep may change as we grow, but everybody needs a good sleep, a good amount of sleep. Now, this graph here is to show us the recommended hours of sleep for different individuals. The babies usually sleep for close to 17 hours, 12 to 16 hours. This is what is recommended over the 24-hour period. But as you get older from being a toddler, preschool, school age, your sleep requirements in terms of duration of sleep are going to become shorter. So as an adult, you need about 7 to 9 hours of sleep in order for you to be fully functional and alert in the next day. Now, we have variants, as you may know, in our lives or in the population. There are people who are highly efficient even after having 3 hours of sleep. This does not mean that they are going to have a very nice time when they get older, because there are many advantages of sleep that they may be missing out, despite the fact that the executive function stays intact in the time that they are still young. You miss out a lot on what we do or what the body does during sleep. So on average, as anybody that is above 18 years, you should be sleeping for about maybe 7, 8, or 9 hours if possible. The sweet spot really for most people to feel alert is about 7 to 8 hours. And this is something that is it's sometimes overlooked. As long as you wake up and you feel refreshed, you feel good to go. But getting less sleep than is recommended has been linked to many things, as we are going to see, including memory problems. But the other thing for seniors are the conditions that we struggle with. Blood pressure becomes a problem in old age. Diabetes has set in after 40, heart diseases, and these things become difficult to treat or difficult to manage when you do not align them or reconcile them with a good sleep. So why does one need to sleep? Many people think of sleep as simply switching off, like turning off, a light bulb. But in reality, sleep is not passive at all. It is a time that is fairly active, where the brain is actually moving through different stages. So, and I said we'll keep the science very, very, very minimal. But I just wanted you to know that when you go to bed, your brain starts going through a number of processes, and these processes are phased or staged. So there are various stages, if I may just use the word stages, from stage 1 to stage 4. So the brain goes through these stages, and then it has about 6 cycles of those stages happening. And those cycles require about 60 to 90 minutes to be completed. So for a good night's sleep, an individual is supposed to undergo at least 4 to 6 cycles of these many stages as you can see them. So if you do not get all these cycles, you'll be fine. But there are some things we miss out. So for example, the first stage, which is the N1, is that light stage when you're feeling drowsy, you're getting into that sleep, that light moment where you're beginning to sleep. And that is just transitioning. But the deeper stages, like N3 or stage 3, this is where the body is going to restore itself. Your brain opens up the cleaning system to take out the dirt. Um, for the sake of everyone appreciating the brain is one place that is well protected. Not many things walk into it. It has what we call a tight barrier for bacteria, for small particles. But during the deep sleep, this tight barrier loosens up a bit. And these things that have been happening in the brain, accumulating toxins, they drop out and they get sieved through the rest of the sieving system of the body, including the kidneys. So when you deny yourself the opportunity to get into this deep sleep, your brain is not completely cleaned up. And this is the reason why people are foggy during the next day. And over time, with poor cleaning, or just like a jerry can, if you don't clean it every day, or your bottle or your cup, if you don't clean it every day, it's going to retain a lot of debris. And this debris is going to make the next use of that cup very difficult and challenging, uncomfortable. So sleep is important for repair, for cleanup, and then there is this type of sleep where your eyes are moving rapidly. That one is very, very important for memory consolidation. And because these stages come late, if you don't get into them, you are going to have memory problems. So sleep in general is going to support health at all levels. The brain, we've seen the brain, but we also have the other organs. There's the heart. During sleep is when your blood pressure becomes lower. We call it dipping. Your heart your heart rate is also going to become slightly lower. Your metabolism is also going to become slightly lower. So it gives the body time to recoup and make sure that everything that is happening slows down and the immune system actually improves during sleep. So on average, poor sleep is going to damage your brain, is going to damage your heart, the blood vessels, the muscles, the skin, the immunity, and so forth. So what really happens? As we age, we do have changes that scientists have called a sleep architecture that changes, or that is the pattern of how we move through those different stages of sleep that we've talked about. And one of the biggest change that has been observed is having less time in deep sleep. So this is the stage largely that restores the body and leaves us feeling refreshed in the morning. However, with age, this stage gets shorter, which is one reason older adults are often going to wake up and say, I feel like I didn't sleep well last night. I feel like I didn't sleep deeply last night. But on top of that, as seniors, we experience more awakenings during the night. And some of these are really caused by things, the medical conditions that we have. We have prostates in males. We have problems with incontinence in some seniors. We are thinking a lot about many things. And the hormonal changes that happen as we age, lower cortisol levels. Melatonin is a hormone that is produced by one of the glands in the body. And this hormone is responsible for making sure of coordinating your 24 hours activities. So if we reduce this hormone, you're going to disrupt the 24-hour rhythm. Despite this happening, older adults still need 7 to 9 hours of sleep. May be difficult to get, but those are the things that happen and change our sleep architecture. In normal circumstances, it is fine to wake up once or twice, but it is not normal to feel constantly exhausted every other morning when you wake up. So once this happens, we know there's a problem. So I just highlighted some myths about sleep that we have in our community and in the expanded community. One, indeed, and I feel uncomfortable when people say older people don't need much sleep. In as much as older people do not appear like they are sleeping a lot, we do need the quality 7 to 8 hours. The ability to get these hours may change, but the reality is that this is needed. Then the other myth is about napping, that if you nap during the day, it replaces the night sleep. Yes, short naps may help, but they should not substitute the deep restorative night sleep that we have. The other myth is alcohol, and I'll talk a little bit more about this later. I have many patients that come to me, even my colleagues, that tell me that a glass of wine, a glass of whiskey knocks me out and I sleep better. But I can guarantee you that alcohol will make you fall asleep faster, but it's going to disrupt the deep sleep and it's also going to cause unnecessary awakenings. The other myth that has been observed, and it is interesting, is that snoring is harmless and people actually feel fine when they snore. So some snoring can happen, but it shouldn't be something that is going to cause you disease. So in a way, snoring may be a sign of sleep apnea, especially when it is in older adults. And by older adults, we are talking about people who are 60 and older. However, we've seen younger people also snoring, and this is usually common in males before the age of 60. After the age of 60, this evens out. Males and females, we're going to be the same. This alcohol helps me bit. I want us to navigate it a little. When you take alcohol, alcohol depresses your brain. So it is a sedative, if we might call it that. It is going to help you to fall asleep faster. You have seen many people when they take a glass of wine and they feel sleepy by just one glass of wine, simply because it is depressing your central nervous system or your brain. But that's the only good thing that it is going to do that day that you take it. Alcohol is going to reduce so many things. One, it is going to reduce one of the deep stages where memory, mood, and learning are going to happen. For those of you, if you want to appreciate REM sleep, the things that I am talking about now may not make a lot of sense, but if you put them somewhere in your brain and you go into REM sleep later tonight, I can guarantee you you're going to remember over 60 to 80% of what we will have discussed. But when you don't get into these deep stages of sleep, the memory becomes difficult to consolidate. So this makes you feel relaxed in the beginning, but ultimately you are not going to get into those deeper stages of sleep. The body restoration is going to be affected. You're going to have fragmented sleep because of frequent awakenings as alcohol wears off. It may worsen snoring because it relaxes the muscles of the throat. It may worsen snoring, and it increases nighttime bathroom trips. So clearly, alcohol may knock you out, but it steals the deep restorative sleep your body truly needs. What disrupts sleep as we age? And the facilitator already hinted on some of these things. Seniors commonly struggle with sleep. As we grow older, many people notice that sleep is not as easy or as refreshing as it used to be. Falling asleep and staying asleep becomes harder, and therefore we have several reasons that are going to impact on the quality of life in relation to how this changes with age. So first, we have these medical issues. Our bodies change as we age, and health problems are often going to affect sleep. People with arthritis, people with joint pains, that is the arthritis, you're going to find it hard to find a comfortable sleeping position. So people are coming in, and yes, I am a clinician. People are coming in to see you, and they tell you, when I sleep, like I can't sleep on my back, I can't sleep, I can't sleep on this side, on the right side. So whenever they turn, because the body will naturally turn, its mechanism as we sleep is to make sure that you don't stay in one position. There's a way we jump out of one stage of sleep so that we can move a bit. And this chemistry makes me believe indeed that God exists, because to avoid a clot, if you went and slept in one position for 8 hours, that is dangerous. But there's a way in which the body is alerted that, you know what, you've slept enough on this side, turn around, even in your deep sleep. So with joint pains, this is even worse, because in some position, the pain is actually exacerbated. Men with prostate glands that are enlarged, heartburn is a very, very important area to address when it gets to the elderly. And of course, lung problems. People are breathing badly. People have chronic obstructive airway diseases that are disturbing them in the older age. But then we also have these drugs that our doctors, me and others included, are giving us to treat these medical conditions, the blood pressure medication. And some doctors are good. They'll ask you how many times you wake up in the night when you take this medication. But The truth of the matter is some of these drugs keep us awake, or they keep us going to the bathrooms because we need to take off the excess fluid. The steroids that we take for different conditions that need steroids in the body make our brain alert. So the brain being alert keeps it in a place where it cannot go into deep sleep. We have lifestyles, we have irregular schedules, we have too many naps during the day, we have naps towards the time that we are going to bed. There are people who take caffeine or coffee or heavy tea towards the evening. Alcohol, like we've already mentioned, then heavy evening meals. These lifestyle choices impact a lot on how sleep is going to be going in the night. But then the environment, noise, heat, light, we know that we are menopausal. We have all these other things happening in our bodies, but it is not helped by the fact that some of the rooms that we sleep in are not as cool. Mental health, loneliness, depression, anxiety, and sleep disorders like sleep apnea. We have a condition called restless leg syndrome, where someone is uncomfortable towards bedtime. They feel like moving around all the time because in their leg, whether right or left or both, they feel like if they sat down in one place, they feel pain, some bit of discomfort in there. And then, of course, insomnia. We shall talk a bit about two of the disorders that we see. One is obstructive sleep apnea. This obstructive sleep apnea, like I said, it's common in older people, but what is it? So this is nighttime breathing that stops and starts. So I'm sure you have witnessed people who snore at night. There are people who snore at night, and as they snore, they could snore for 1, 2, 3 minutes, and at the peak of the snoring, the throat becomes blocked. So the throat muscles have relaxed, the tongue falls back in the throat, and the throat becomes blocked. At that point in time, there is no air that is going to move in or move out for a brief moment. But these brief moments are brief to different individuals. Some people's brief moments are just 10 seconds. Other people's brief moments are more than 10 seconds. Now, if a, a block in your airflow goes for more than 10 seconds at that point in time, this is not normal. A breathing pause that is going to take more than 10 seconds after you've been snoring, this is not normal. So many times for you to wake up, or rather to breathe again, you have to wake up as if you are drowning and you're startled, and you wake up over and over in the night. This is definitely going to disrupt or give you a bad quality of life. So people who are snoring, gasping or choking at night, you wake up with a dry mouth, people that have morning headaches, daytime sleepiness and tiredness, poor focus, these may be signs that show that somebody probably has obstructive sleep apnea, or that nighttime breathing that stops and starts. It's also imperative that we know that this obstructive sleep apnea is going to raise your risk of getting blood pressure, high blood pressure, heart disease, strokes, and worsening the control of diabetes. And of course, the older persons that drive, because you are tired during the day, you're going to get into car crashes, affect mood, when you see grandma, grandpa, grumpy that day, you probably think about it and you say, maybe their sleep was not nice. Maybe, let's think about this. So what to do? We have simple tests that can be done to check this out. Treatments are also available, which are going to keep the throat open, and they come in various ways. So this we can look at, but we also ensure that we take less alcohol, because when you take alcohol, it relaxes your muscles more than what normally should be, and then the obstruction is more imminent. Then insomnia. So the two things that I wanted us to highlight is the obstructive sleep apnea, but then there is insomnia. Insomnia simply means when sleep won't come, or when you sleep, it won't stay. You get into sleep, and then within a few minutes, you are awake, and then it takes a long time for you to get the sleep back. You're in bed, trouble, tossing and turning. So this is also not normal. However, if you have trouble falling asleep, you're waking often or waking too early on at least 3 nights a week with daytime sleepiness or irritability, this is when we say this is a disease process, if I may put it that way. Many times we all have insomnia because we have things that are going on around us and are disorganizing us. Let's say yesterday I was talking to a friend of mine who I was requesting to give me a scholarship for travel for a certain conference. And the man told me his colleague, stakeholder in the business, ripped him of 5 billion Uganda shillings. I couldn't even go further with my request because I can't imagine how I would rest if somebody has ripped me of 5 billion Uganda shillings in the current state of affairs. So this would definitely make you become restless. You wouldn't sleep, but that is a short term if indeed you're working on it. However, if it is long term, it is happening every night or 3 nights a week for more than 3 months, this may need treatment. And the common causes in older patients or in older adults is the pain again, the frequent bathroom trips, worry or low mood. I've seen people, I went to visit a gentleman who was sleeping with his key in his jacket. The key was access to a certain area where he had his land titles kept. So this, I am sure this man was having trouble sleeping. So he has this worry about what is going to happen to his property after he's left. And he's probably thinking, but the medicines, irregular sleep habits, snoring, and sleep breathing problems are common causes of insomnia. So in a way of dealing with this, we need to ensure that we get regular sleep schedules, getting morning sunlight. You know, sunlight in the morning is the cue to show you that your 24 hours have started. So if you do not get these 24 hours started by that morning sunlight, then the body is going to register that we are still in the previous 24 hours. So that morning sunlight, 7, 8, is very important. So these are late night naps. We should avoid them, limit caffeine after lunch. Caffeine is usually, it has a half-life of about 8 hours. So if you took it after midday, it is going to stay in and potentially give you sleeping issues or sleeping problems by 8 p.m. So we always encourage in sleep medicine that the last coffee mug that you take is probably about midday if you're going to be asleep by 8. And skip these alcohol things, these alcohol drinks at night as a nightcap. When to seek help, we've talked about it, but I want to stress one thing. The use of sleeping pills should be done very sparingly and only if you have to. And if you have to, it is for a short term only. Sleeping pills are not the solution to insomnia. And I have been approached by a couple of patients from time to time who say, you know, you're a sleep doctor. I am not sleeping. Prescribe for me something. And this I try not to do because of many things. So what are the ABCs of a better sleep? We are going to look at these a little more, but the atmosphere, the behaviors, and then clock and routine. The body has a biological clock. So we move with this biological clock that has been set according to the clock that we have on Earth. I think the universe largely has 24 hours for all the planets. There's only one planet, I'm told, which is slightly more than 24 hours. But for the rest of the planets, it's 24 hours. So in terms of atmosphere, where is the place where we're actually going to sleep? Is it a dark, cool, quiet room? Do we have a good mattress? We need to invest in a good mattress, good beddings for a good night's sleep. And this happens for everybody. If you definitely have an uncomfortable bed, your sleep, the quality of your sleep is going to be impacted. Then we also have to improve our behaviors. Because we have a 24-hour routine, we need to have a regular sleep and wake time. When we do not train our brain to have this regular sleep and wake time, the biological clock or the circadian rhythm that we have in the body gets disorganized. That's why you see when you travel from here and you go to a place where you have 8 hours ahead of Uganda, you are not going to sleep at 8 p.m. immediately because the clock requires that time to reset. It needs to be trained again. So without that training happening, we are not going to have a quality sleep that day or until the brain now matches the routine of the other side. Limit caffeine, avoid alcohol as a sleep aid, and daytime physical activity is also important. Many elderly or many seniors tend to stay in the house for too long. They spend the whole day in the house, the night is in the house, the next day is in the house. They need to get out. Exposure to sunlight helps to try to tell the brain that, you know what, it is daytime. You're not supposed to be sleeping. There are other hormones that build up as we go through the day. And when you stay in the dark for a long time, you're definitely not going to make the body produce those hormones. In as much as the hormones are produced in fewer amounts as an elder or as a senior, you still need to have these hormones, and they are going to be stimulated by light. Keep the bedtime rituals. If you have a bedtime ritual and it helps you, keep it. Avoid screens and other things like phones at least 1 hour before bed. And of course, reserve the bed for sleep and intimacy, not for worrying. Don't say, I am too disappointed, and then you go to bed to worry from your bed. No, do not do that. Go to bed only when you feel sleepy and only when you feel, or if it is another engagement with your partner. Okay, so these are the practical tips that I would want to leave behind for you. Same schedule, bedroom setup, wind down time. For the last 30 to 60 minutes before you go to bed, do things that calm you down. Soft music, prayer, light reading of a book, a novel, and this light that comes from these screens, the phones, the TVs. People have TVs in their bedroom. I know a number of people that have put TVs in their grandparents' rooms because they want the grandparent to watch TV, but this impacts on the quality of sleep. Drinks and food, stop caffeine after lunch, skip alcohol, light dinners, have a few hours before bed. Move your body, but don't do it right before bedtime. When you move the body right before bedtime, you now alert the brain. The brain wakes up. The brain is saying, oh, maybe it's something that we are preparing for. There's something that has started. At this time, we're supposed to be winding down. So exercise should not be right before bedtime. Naps, if you must take naps, they should be short and in the afternoon. If there's a nap that is coming up at 6 p.m. and yet your bedtime is 8 p.m., find something to distract you and move around. Do not get tricked into having that nap. Stimulus control. The bed we've said is for sleeping and sleeping only, or maybe for intimacy. Don't go to bed to work. Don't go to bed to have long chats, because this keeps the brain alert. Go to bed when sleepy, not just when the clock says so. When you feel sleepy, that is when you should go to bed. If you go to bed and you align this bed with other things other than sleep, every time you go to the bed, the brain will think it is time for those other things. So when you feel like, when you go to bed and you cannot sleep for 20 minutes, jump out of that bed. Don't stay in that bed. Go out, get a dim light somewhere, sit down, do something calming, then return to your bed when you feel sleepy. The time of onset before you sleep, when you have gotten into your bed, is very, very important. Some people close off like light bulbs. Somebody goes, I have my son, when he goes to bed, within 2 minutes, if you need something from him, you're not going to get it after 2 minutes. And I feel like everybody should have that, but sometimes it doesn't happen. Some people go to bed and they're tossing and turning for 30 minutes. Please don't do that. It's a bad habit, and we can actually improve it by just getting out and walking around. Of course, there are treatments that we can give as health workers. So it has been proven that talk therapy is a program referred to as cognitive behavior therapy for insomnia. This talk therapy happens in many other places, but we also have it in insomnia. It helps you to reset your sleep, manage your worries, and reshape unhelpful beliefs. If you have a belief that I'll never sleep, there are people who are constantly hitting your your inbox, and they're telling you, Doctor, I didn't sleep last night. I've tried this, it has not worked. Then you tell them, calm down. The next 1 week, that, Doctor, what you told me to do has still not worked. So that I'll never sleep is a bad thing to the brain. So you have to fine tune yourself and reshape these unhelpful beliefs. So this has been proven to work, and it can be provided by people that have been trained to offer this. When do you seek help? When you have persistent insomnia. Like I said, insomnia could happen because of an acute event. You're stressed because you have a loan coming up, or a deadline coming up that you're not ready for, and so you can actually lose some bit of sleep. But if you're going to have this for more than 3 months, I have a patient who came to me and told me that I have not been sleeping for 1 year. And I told them, why haven't you been sleeping for 1 year? And told me, you know what? This happened. I got this job. Then I took on the other job. So I'm running 2 jobs. I am managing 300 people. So we told him to either cope or to quit. Of course, he went away, and he decided to quit one job, and we lost the patient, of course, because he never came back to seek our help. But at least it helped him. He became a much better person. He just called us one day and told us, you know what, doctor, I quit the other job. I am now on one, and I am sleeping. So trouble sleeping for more than 3 nights a week for more than 3 months is not normal. So we should seek help for this. Loud snoring and choking and gasping, daytime sleepiness, the restless legs that I talked about, or abnormal movements in sleep. Some of us kick our partners. Some of us go to bed and we wake up when the blanket and the bed sheets are off the bed. So some of these are abnormal movements that are happening in the night, and you are not going to know about them, but they disrupt sleep, and you wake up a person who is not fully rested. Sleep problems are treatable, my fellow colleagues that are here, and we can actually try to treat them. So what's the take home from here? I want to repeat that sleep is not a luxury, it's a necessity. Even though sleep changes as we age, it remains essential for our hearts, for our brain, for our mood, for our immunity. And if you're struggling, make sure you fix these routines, wind down, morning lights, limit caffeine and alcohol. We have some medicines. These medicines, ladies and gentlemen, should come last, not first, and for a short term only and with guidance. I know so many people that are taking diazepam to sleep. Ladies and gentlemen, let's try to avoid these sleep medications. We need to find out why we are not sleeping and address the reason why we are not sleeping. So start today. Pick one habit to change tonight. And I want you people to prioritize your sleep as if it is food, it is exercise, or that medicine that the doctor told you that without taking this, your heart is going to stop. So always seek help if sleep problems are persistent. Chair and facilitator, thank you very much. I would beg to stop here.
Wow, thank you so much, Dr. Ivan Kimuli. This has really touched most of us. It has knocked on our very unhelpful habits we take on as old adults. I'm sure many of you have gathered a lot of information, helpful information from this talk. I don't want to be selfish, but I want to ask Dr. Ivan, or to put a scenario where this old adult is living in town, even suburbs like Bogolovi, and you've tried to do everything to make your home conducive to sleep, but then the neighbor has a church, the neighbor has a school, the neighbor has a disco. You know, you are surrounded by a lot of noise. One way of countering this noise is actually putting noise in your own room. That's why you have those TVs in the rooms. At least you put it loud enough so that you just hear what is going on that TV. It could be music, it could be something else. I know it's not, it's a good thing, but with our planning in the city, we have no choice but to do that. And therefore, I'm asking, is there a way the medical school or your department can, one, pass on information about the need for residential areas to be free of activities like that, as a recommendation, a strong recommendation from people who have actually studied sleep like you, in the way that, you know, they give licenses for activities in residential area, which definitely cannot let the residents sleep. Is there a way we can, you can plan to have either enlighten the Kampala City Council, Mbarara, or whatever, so that they help out to lessen this noise and lights in the city, because the residents are their residents. We are not going to run away tomorrow, but we are killing each other by, you know, mixing business, night business in residential areas. Or if that is too much to ask, probably have tailored talks to different council members in the city, council members to different groups of people, being enlightened of this danger. We are killing our own population in the city. In Kampala, at least where I live. I don't know if I'm clear, but I don't want you to sit on this rich information and not pass it on to the planning authorities. And probably it's a bit selfish, but that's what I feel after learning so much from you this morning. And members, I'm sorry to have been so selfish, but we are now going into a session of questions and answers for the next 20 minutes. And you can put your questions in the chat room, or you can raise your hand and contribute with voiceover. Please feel free to give your experiences, give your tips to each other, because this is for the health of us all as we age. Thank you. So far, I've got some comment from Slivia. Thanks, Dr. Kimuli. My question is it too much? Is too much sleep bad? My grandmother can sometimes sleep from 8 p.m. until 8:30 a.m. or even longer. Do we have to worry about that? Then the other comment is, thank you, Dr. Kimuli. This is from Anne. Are there any initiatives to cause schools to allow children sleep for a minimum of 8 hours? And Maria or somebody is saying, thank you so much. Where can an elder seek help for headaches coming in middle of the night? Please, doctor, you can answer those three, and we continue.
Okay, thank you very much for your questions. I'm not saying you're selfish. I think you're just speaking for many others that are staying in those areas. I also happen to be interested in pollution, particularly air pollution. But when we are having our discussions on pollution, on air pollution, we put all pollutions together, and there are strategies that are being developed to ensure that pollution is curtailed. I know the powers that be are part of this Ministry of Energy, because that one has its own source of pollution. But NEMA, largely, we're all under the umbrella of NEMA. And I've had colleagues of mine that have reported to NEMA and have been helped. Others have not been helped. It's largely a policy thing and implementation. So in the spaces, in the boardrooms where we are invited to present the case and impact of pollution on health, we always present this information and the health impacts. We will make a case for the need for reduction of pollution in all aspects. So now the onus is, I think, on the general public to make noise so that the powers that be appreciate that this is actually a problem. But I can guarantee you that behind closed doors, when invited to talk as technical people in the area of health and the impact of pollution on health, we have presented the case. I think Dr. Kadama, we may have to form a group. You know how we have formed associations or groups of individuals that have championed a couple of things. We do have champions in drug delivery. We do have champions in abuse of rights of this kind of nature. So maybe some of these things may also help when you have not a pressure group, but an advocacy group that is going to strongly advocate for some of these things, of course, with many stakeholders, including health workers and others that are interested. So that may be one way to go. Yeah. So, and thank you for bringing that up, because it is very important. People don't sleep simply because of the noise that they have in their neighborhoods. And that is part of the environment that we are talking about. So now to address the question of grandmother,
the grandmother.
who sleeps for long, I think the short answer is probably not. For many older adults, spending 11, 12 hours in bed, it can be normal. Because as they are there, you're probably not watching them sleeping for all these 12 hours. They are having multiple awakenings that they may not even remember. But the most important thing is how she feels and how she functions when she wakes up. Or if it is new, if this sleeping of 10, 12 hours is new, then you get concerned. And new, persistent, and she still feels sleepy in the day, then that one is worrisome. Would need to find out why this is actually happening. But if the long sleep is not new, she wakes up refreshed, she's alert in the day, manages her usual activities, that may be considered to be fine. But look out for the things we talked about. If she's foggy during the day, she's having multiple pauses in the night in breathing, gasping, or if you have introduced any new medications, these are things that can actually that can make us do something about it. Or if it is associated with other signs, weight loss, appetite change, I know people who have thyroid problems may also have long hours of sleep. So if they are having cold intolerance, they feel like they cannot do well in a cold environment, they need to be warmed up. You may need to do something about that. But on average, this can actually happen in a normal setting. As for children, I think that's another policy thing. I don't know if there are any policymakers on that call that could give us some guidance on what they think. As a health worker, I may be in position to tell the policymakers that these are the effects of poor sleep on a developing brain. I may not be able to tell my school where my son goes that, you know what, stop this, and they implement that. This is something that has to come from policymakers and the enforcers of these policies to ensure that these actually happen. But I know that the Ministry of Education has this at the core of its business. However, I may not be competent to speak on behalf of what Ministry of Education is planning to do about this. I submit, Chair.
Thank you so much, Dr. Kimuli. Is Edgod still having a hand up?
Yes.
Okay.
Thank you so much, Dr.
Yeah.
Thank you so much, Dr. Kimuli. Mine is actually like an addition of what is happening. These days we keep on saying, oh, the kids of these days, they are so, we call them either spoiled, or we call them that they are like the broilers, they are very sensitive. But actually what is happening is that our kids do not get enough sleep. A child who is supposed to sleep for 8 hours, they start going to school at about when they are like 2.5 years, and you know the jam of Kampala, and they have to be on the road by 5:30, and then they come back, those who are coming back after we have finished working. So you find that actually our children have been deprived of enough sleep. And this is continuing to our old age, even the current, the current generation, you find that they are over sensitive, just because this thing has affected their development mind. So as parents, I suggest that we have to be intentional and see that at least these young ones, when it comes to weekend, we find a way of making them at least sleep to compensate. But otherwise, our moods are overly affected just because we don't have enough sleep. And when it comes to the young one, the youngsters, they have so much that is going in their lives. Before, after work, they want to go and socialize. By the time they go to sleep, it's about midnight. After that, they have to wake up and be in office before 8. So you find that such people are getting overly moody just because of deprivation of sleep. So us who are aging, who are lucky that we had our sleep, we need to be cognizant of the fact that the people who are around us are having challenges with sleep, and mostly we have to look at how they are the activities and then advise accordingly. Those who can still advise. But thank you so much. This has been a pertinent topic to talk about, which affects us also in our old age. Thank you.
Thank you, Rotarian Edigod. I would like to call upon Martha to please modulate this question and answer for the few minutes left. Martha.
Okay. Thank you so much, Dr. Christine, and thank you so much, Dr. Kimuli. For the next questions, Anna Serada asked, thank you, Dr. Kimuli, for the insightful presentation. I have a question. When I was in my teens and early 20s, I often experienced something unusual during daytime naps. I would feel awake in my mind and want to get up, but I couldn't open my eyes or move my body for about 2 to 3 minutes. Eventually, my body would respond and I would wake up. This no longer happens, but I am curious what was happening to my body during those episodes and what condition might that have been. Then Simon also asked, what are the specific medications that cause insomnia? And for the next question, this person asked, what will happen to our children in school right from nursery who are no longer sleeping this much because of school schedule and jam in the cities and the issue of picking them as early as 4 to 5 a.m.? What can parents do to help their children to get enough sleep while at school? Thank you, Doctor. You can please respond to those questions before we move to the next.
Okay, thank you very much, Madam Martha. I think for the question on what someone has described as what I would call freezing, there's many disorders of sleep, and one of the disorders is sleep paralysis. What you're describing is sleep paralysis, and it's quite common, especially in the teens and 20s. But it's usually harmless and it wears off. And it's something that happens because of one of the stages in sleep that we talked about. In the 4 stages of sleep, one of the deeper stages is referred to as the rapid eye movement stage, which is REM. REM stands for rapid eye movement. Now, this is the stage in which 85% of our dreams occur. So you can imagine many of the dreams are nice, others are not nice. Sometimes you may dream when you're being chased by a lion, God forbid. But God is
And
so God is so much of a designer that when you get to this stage where you dream, there is what we call muscle relaxation, complete muscle relaxation. All your muscles are relaxed, that even when you want to move, I don't know if you felt that moment where you're being chased or you want to run away from something, but you feel you're raising your body up and it just can't move. So it is because the brain has switched everything that is going to contract or make a muscle move off. So you do not harm yourself during sleep and you do not harm others, maybe your bed partner. So this is something that can happen when you're sleeping. But now your brain may wake up before the muscles actually become active. So in your brain, you're going to fully be conscious and aware of what is going on, but you try to move your body and the body just can't move until maybe 2-3 minutes later, the muscle structures also wake up, and then you're like, wow, I couldn't move for the last 1-2-3 minutes. But that is what we call sleep paralysis. It's really temporary, and it's common at that time that you described, and it is something that you shouldn't worry about. But of course, it has other things that can bring about this. People usually in that age, they are very active, they are sleep deprived, they have many things going on, and these can actually impact the occurrence of such things, including some brief hallucinations, but it is usually benign. So it's nothing that you should worry about. It's unlikely to recur as a senior. In terms of drugs, now there are so many drugs that can cause insomnia. I don't know if we need to go through all of them, but one thing that I can guarantee you is some of the drugs that we actually use for depression, the antidepressants, can actually cause insomnia. These drugs that we take for flu, they often have these products that can make us stay awake. Some of them actually contain alcohol stimulants that are going to fragment sleep. Then there are drugs that the cigarettes that people are using. Of course, we have already talked about drugs that contain caffeine, the high energy drinks that people take. But in general, there are quite a number of drugs. Of course, the ones that we give people that have a lot of water being retained by the body, those are going to cause a lot of awakenings in the night because you have to go and pee. There are drugs that are used for psychiatric illnesses. So there are quite a number of drugs that are in the formulary that are responsible for causing insomnia. So we may not be able to list all of them, but those are just some. Back to you, Martha.
Okay. There's a hand up. Please raise your question before we can move to the next questions. Hello, can you hear me? Lieutenant Betty Namuwiru.
Rotarian, maybe.
Are you still on? Okay, let me continue as she prepares herself. So for the next question, another person asked, does the position of sleep matter? Is it lateral on the back or on the tummy? Then there was a question of, could sleep deprivation be causing suicide in school-going children? Then the other question was, can one sleep deeply while eyes open? Dr. Kimuli, you can answer those questions before we move to the next set of questions.
Okay. Sleep deprivation in children. Maybe I should start with the position of sleep. In general, everyone finds their comfortable spot when we sleep. There are some people who will tell you that they sleep fine when they are on their tummy. There are others who will tell you they can't sleep well when they're on their backs. And another one tells you, when I side sleep, that is when I enjoy my sleep. So really, the position of sleep doesn't really matter. It only matters when somebody snores. When somebody snores, one of the positions that is going to make the air will get to be clogged again is when you sleep on your back. If you realize that people who are sleeping and then they turn on their back, that is when they are going to snore loudest or snore the most, because this directly gives an opportunity for the tongue to fall back into the airway. And that is the only time I tell people not to sleep on their backs. But whatever position you get, as long as you get your quality sleep, it doesn't really matter. Now, in terms of sleep deprivation, it definitely, we've talked about many things that sleep deprivation does, especially when you need a certain amount of sleep and you don't get it. So we've said that young people are still growing, their brains are developing. Now, if they do not sleep enough and they end up having the cleaning system not fully activated in the night as they sleep, then you're impacting on the stages of development of that particular individual. First of all, they have to retain information, because memory is always consolidated during sleep. I would indulge you, when we were students, many times if we had a paper the next day and somebody actually reads their content and goes to bed and sleeps for a good 6-7 hours, and then another person reads all through the night and comes in to do the paper, I don't know if you remember who would perform better. Definitely the person who's gone to bed and slept, because once you get into those deep stages of sleep, that memory is going to be consolidated. What you have read is going to be retained. Now, because of these many things that happen, anxiety, depression, all these things are very common in patients who actually don't sleep. And at the same time, they on their own are also going to worsen the not sleeping. So it is something that is key, that we should sleep to avoid any of these mental illnesses that could come. And I'm not saying that suicide, the cause is lack of sleepiness, but or rather lack of sleepiness causes suicide. But I know that mental illness, suicide is one of the mental illnesses, and indeed it could be in there. Now, someone was asking, can you sleep with your eyes wide open? So the short answer is you can sleep with your eyes partly open, but it's not typical. And to get into the deep phases of sleep, the deep stages of sleep, like the eyes to move. Right now, if you were to close your eyes a bit and you imagine the eyeballs rolling very fast during that stage of sleep, there's no way that can happen when your eyes are wide open. But we do have what we call micro sleeps, brief episodes of dozing that happen just for seconds. But this is not very common. It's usually noticed in children as brief variants, but not very common in the general public. Indeed, when it happens, maybe there's a problem. If someone has paralysis of some of the muscles and the eyes can't close or something like that. But in actual sense, physiologically, this is something that doesn't often happen.
Okay, thank you so much, Dr. Kimuli. So for the next set of questions, there were two questions about how can one eliminate snoring and is snoring treatable? Then there's a comment from Dr. Susan. Thank you so much, Dr. Chimuli, Yale University trained sleep specialist of Ugalo. I am disappointed that you recommend strict routine sleep schedules, including weekends. I was hoping to use weekends to catch up on that sleep date. Then the next question is, what do you make of vivid dreams that rudely interrupt sleep, and are they of concern if they are persistent? Dr. Chimuli, you can go ahead and answer those questions before we move to the last set of questions. Thank you.
Okay. Snoring. Snoring is my cup of tea because this is one of the common sleep disorders that are easily treatable. It becomes treatable when you have if everything seems to match up, that this person is snoring and they have what we call obstructive sleep apnea. So snoring with pauses in breathing and awakenings with morning headaches, and you have this lack of clarity during the day, this needs to be treated, and indeed it can be treated. One thing we have seen is that there are some behaviors that promote snoring. One is going to be the position in which you lie. Two is going to be the alcohol that somebody is going to take during the night or shortly before they go to bed. And these are going to make the muscles very relaxed in the night so that someone's airway collapses or someone's throat collapses and then they snore. So we do have treatments that are available. One is to increase the space that is in the mouth so that the tongue has enough room to play around in the night as you sleep. Because we've noticed that people who have a small space in the oral cavity are the ones that are largely going to suffer with snoring. But we can increase that space by some mechanisms. We can also make sure that the airway stays positively open by giving you some air in the night as you breathe, such that the airway has some air, keeping it open all the time. And these are mechanisms, these are treatments that are available in Uganda. Now, the other treatments may not be available right now, but with assessment, we can determine what treatment can actually be given to a person who has obstructive sleep apnea. Snoring is not the same as obstructive sleep apnea. Snoring is the noisy breathing that someone makes when they sleep. But if it is accompanied by the other attributes that I've mentioned, then clearly that person requires to be treated. That snoring needs to be treated. Now, thank you, Dr. Susan, my old girl, my OG at Yale. And I know why you're asking this. This is something that happens to all of us. We have this rat race during the week, and we are waking up at 5 a.m., 4 a.m., and we plan to catch up on. We plan to catch up over the weekend on this sleep. I mean, it helps to catch up on the weekend, and practically that is what happens. A big Saturday sleep-in can improve sleepiness and mood, but it doesn't fully repair attention and metabolism of your body clock. So the 5 days that you've missed out on the deep sleep is a huge loss. And that one, you're not going to open up on Saturday to say that, oh, you know what? I am recovering this memory that I didn't consolidate. No, those 24 hours are gone. The next 24 hours are also gone. So you have these other hours. It's just going to help you with resting and take away that sleepiness. But there are other things indeed related to body repair, the spikes in the blood pressure, and pulse that or heart rate that you will have missed out on the previous 5 days. So that can help, but only just for you to catch up on the sleep deficit, but not on the benefits. So it's not an all or nothing. There is no military precision, but trust me, there are things that you're going to miss out on if you're going to wait for the weekend. I don't know if I've missed any other question.
Okay, there were, for the last set of questions, I am going to just repeat this again. What do you make of vivid dreams that rudely interrupt sleep, and are there any concerns if they are persistent? Then if you sleep, talk, walk, and others, does it affect your rest? And then the last question is what causes a child of 8 years fear to sleep alone? Over to you, Dr. Chimoli.
Okay, thank you very much. I want to appeal to Dr. Kadama. Dr. Kadama, I thought you were about seniors, but it's okay. It is okay. So so when someone wants to say the vivid dreams that we talked about, I remember I told you that most of the dreams we get happen during the one of the deep stages of sleep that is referred to as the rapid eye movement stage. And these dreams that wake you up are usually in that stage and are sometimes linked to a number of things that have been happening around you. Sometimes it is stress, sometimes it is some medications that someone is taking, and they are fairly common. And they're a bit distressing if they're happening after 50. But in the young people, the stress, the irregular sleep patterns can actually cause these things. So you've seen people who are grieving, they get these people who are taking drugs, the cannabis that people take, and they are withdrawing from it. This can also cause problems. But now they become a problem if they are causing fear of sleep and they are actually being acted out. If someone acts out their dream, it may be a sign of something deeper than just a vivid dream. So kicking, shouting, falling out of bed because there's this scary animal or there's this house that is burning and you're the one inside, and then you find yourself running out of your bed and falling and hurting yourself. This is not something that should not be addressed. The earlier question that was raised by the teen experience of sleep paralysis, that one is also something that may point to a condition called narcolepsy, but it's something that can, if it is persistent, it is something that needs to be looked into. So new vivid dreams, persistent vivid dreams after the age of 50, sometimes they need to be addressed. There may be an underlying disease that is happening probably a nervous system disease or something else. And of course, we've talked about the sleep apnea. If someone is presenting like this and they have features of loud snoring, morning headaches, this kind of experience needs to be addressed. Otherwise, on the whole, they are benign. They are usually innocent as long as they don't harm, and they are happening much earlier in your life. Okay. So I don't want I don't want to scare anybody, but the actual truth is, depending on what age and how it is presenting, you need to do to either stay calm or to seek medical advice. Now, a child fearing to sleep alone. Sometimes these are natural things. They're normal developmental worries, bigger imaginations. Children are fearing. They have talked about things in the day. They've done this, and of course, there are also separation concerns, wanting a parent close. My son is 7, doesn't want to sleep in a room where the lights are off. He wants the bathroom light on, the bedroom light on. So some of these are happening, and they are not things that should worry you as a child. But if this happens when someone gets older, if you find an 18-year-old who's struggling with this situation, then that is something you need to look into. But as a child, these things are common. Okay. There are many questions. Some of them I wasn't able to write all of them down, but I think I see. Martha, what was the third question?
So the third question was, if you sleep, talk, walk, and others, does it affect your rest? Then there was also a question of what's the best way of waking up someone in sleep? And also, what about those who work at night? How does lack of night sleep affect them? Then there was also a comment of please share your contact so that people can reach out to you.
Okay, so yes, I think in terms of sleepwalking, sleep talking, these are some of the disorders of sleep, and they need to be addressed, especially if they are happening and they are a danger to the child. There's a patient who actually feeds in the night, but they actually wake up and they don't know that they were feeding in the night. They get up, they go to the fridge, open the fridge, pick stuff, they eat. And one of the things that made them realize that they could actually have a problem is when they gained weight that they couldn't explain. So when this happen, definitely they are going to affect your rest. When you sleep talk, when you sleep walk, when you do other abnormal or what we call disorders, when you experience other disorders of sleep, these are things that are going to impact on your health, definitely your rest and your health. So yes, it is going to impact. Best way of waking someone. That's an interesting question. No one has ever asked me such a question. What's the best way of waking someone up in sleep? I'll probably have to do some literature search on this one. But like I said, sleep has quite a number of phases. Stage 1, 2, 3, and 4. So light sleep is usually the first stage. So that stage is easy for someone to get to reverse. You know that moment when you're about to fall asleep, then you jump out of the sleep, you're normal again, or you're alert again, then you about fall asleep. So that is stage 1. So I'm not so sure there's a best way of waking someone up from whichever stage, but I imagine disrupting someone's deep sleep, you are going to impact on their restorative capacity that they have entered into. Remember, I said that an individual goes through 4 to 6 cycles of this deep sleep in a night. So if you're going to wake them up from their sleep phase, from their deep sleep phase, there should be a good reason. In terms of which way to wake the person up, I can't tell you that I know. But I imagine you have to be gentle, not pouring cold water the way people used to do in military camps. I don't know where, but try to be as gentle as possible. But know that you're depriving somebody because you don't know which stage of sleep they are in, whether they are consolidating some information in their memory or not. So the people who work at night. So now that's a different area of interest. These are usually called shift workers. So sometimes they are working during the day, then the other week they are doing night duty, and this is very common in some kinds of fields. It happens to pilots who are supposed to be highly executive. They are moving from Uganda at 8 p.m. and yet somewhere else they are running, it is 8 a.m. and then they reach there and it is already another 8 p.m. And these things disrupt their way of working, their mechanism of fixing the body clock. So that shift work messes up your clock, and so it's going to affect a bit of your sleep and alertness. It is going to disrupt the mood, the brain. It's going to cause you a bit of irritability, and indeed, shift workers have been studied, and there are some particular conditions that they struggle with in future because of these recurrent shifts in their circadian rhythm. Their biological clock is always being interrupted. Today, you're keeping it active, and then when it's supposed to be switching off, you're switching it on. When it's supposed to be switching on, you're switching it off. Some people have found mechanisms of doing this to the point that if you're a shift worker and you want to make sure you get a quality sleep, during the day when you're going to sleep, you make sure that the room in which you're going to sleep is a totally blacked out room. So you get a complete blackout room where the glass, nothing is going to bring in any light, such that your brain is now tuned to the fact that, you know what, there is no activity I'm not getting activated to work. So there you will get some good rest and you'll be able to get into the deeper phases of sleep. But if you do not have a complete blackout in the room that you're going to sleep in during the day, this is going to significantly contribute to all these other problems that we have talked about, the diabetes, the metabolic and heart diseases, and all these long-term things that may come up even in future. You know, when you don't sleep for a very long time, you actually develop mental, let me just say, there's a certain Alzheimer's predisposition that someone gets because they have not slept for some time. And this starts as simple brief notes of remembering, of lack of memory. When your memory becomes foggy, and you can't remember some things, and then you're the kind of person who has not been sleeping, there's a possibility. So indeed, night shift workers have to design sleep strategies that can help them get out of this situation. So the light dark hormone regulation is very, very important. I don't know if I can take on all the questions.
Dr.
Yeah.
Kimuli, I think we cannot exhaust all these questions. We are very, very grateful for that talk. It's been touching. It touched all our lives, and we've got the tips. I'm sure everybody has got a carry away tip to make better sleep, whatever your age is. And I just want to say thank you so much. We've taken a lot of over 2 hours of your time this morning, and we are very, very grateful. Remember, all of you, better sleep is possible, and the changes have been listed. Make small changes in your environment, in your habits, and whenever it's necessary for you to check with the doctors, we've got the doctors already on board. You can check with them to make sure that you get adequate sleep for health living, for aging purposefully. All of us, whether you are 60 or you are 40, we are all aging, and we need to age purposefully. I just want to pass a few reminders for those of you who do not have our contact. Please make sure you leave yours in the chat room. Martha will take care of that, so that you can get the recordings and all other notifications directly into your mail. Then on the 25th of October, we are going to have a talk on caregivers. Please, whether you are an older adult or currently a caregiver, book this date so that you attend and hear from the other side of caregiving. We've been talking about ourselves, the adults and those who are aging, but we have the group of caregivers and we need to move along with them. And November, which will be our last session this year, we want to come together. I'm sure many of you do not see each other. We've not made practical sessions this whole year. So also you book, the date will be communicated, but make sure you are with us so that we share direct. There are those things which we cannot exhaust when we're online. We would like to have a session where we can share direct as people who want to age purposefully. So it's important to leave your contact. It's important to book, always book your last Saturday of the month, 10 to 12 or 11:30 a.m. to be with us. And thank you so much, all of you, for coming. Thank you so much for all the questions and all the comments you've made. And I'm sure you'll agree with me that Dr. Ivan needs a huge clap from all of us for the tips and everything he has given us this morning. And on that note, please have a beautiful weekend and see you soon at the end of October. Thank you. Bye-bye.